Good afternoon, everyone. This is Christen Rachul speaking. You have joined Anatomy of a Pandemic, COVID-19 and the Internet, hoaxes, misinformation, and fake news. Before we begin, I would like to give a territorial acknowledgement. I would like to take this opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta, and also to acknowledge that the city of Calgary is home to the Métis Nation of Alberta, Region 3. The Anatomy of a Pandemic series came about as a way to showcase the work of the O'Brien Institute members, as well as the wider University of Calgary community, and what we are doing to support authorities and governments in the response to the unprecedented scale of and human cost exacted by the COVID-19 outbreak. I'm moderating this series. I'm the interim scientific director of the O'Brien Institute for Public Health. This particular presentation, as well as our past webinars, are recorded and can be found on our O'Brien Institute website at o'brieniph.ucalgary.ca. Today, I have the great privilege to be able to introduce our three speakers. The first speaker will be Dr. Cheryl Peters. She is my colleague at Alberta Health Services. She's an occupational and environmental epidemiologist who investigates ways to prevent cancer and other diseases in occupational settings and new and emerging health hazards in our work and community environments. She's a research scientist in our Department of Cancer Epidemiology and Prevention Research, and she's also appointed as an adjunct assistant professor in both community health sciences and oncology at the University of Calgary. She will be joined by Dr. Christen Rachul, who is an applied linguist with the expertise in health and science communication in a variety of contexts, including the popular media, public health initiatives, and medical education. Christen received a PhD in applied linguistics and discourse studies from Carleton University in 2016, and she's currently the director of research in the Office of Educational and Faculty Development and assistant professor in the Rady Faculty of Health Sciences at the University of Manitoba. And our third speaker will be Dr. Gordon Pennycook, who is also a PhD trained scientist, an assistant professor at the University of Regina's Hill Levine School of Business. He researches human reasoning and decision-making, and his work sits at the intersection of cognitive and social psychology. His work has spanned numerous topics, including religious belief, sleep paralysis, morality, creativity, smartphone use, health beliefs, science communication, pseudo-profound bullshit, delusional ideation, fake news, misinformation, political ideology, and science beliefs. These three speakers were very fortunate to be part of a rapid response grant for the COVID-19 crisis that was funded through CIHR. And this project that they were going to be presenting different components of is led by the nominated PI, Dr. Tim Caulfield from the University of Alberta. I would also like to point out that today's session does involve a question and answer component. So our three speakers will be speaking for about 45 minutes, which will allow us 15 minutes at the end for any questions that our audience might have. You can ask your questions through the Zoom Q&A chat box, and we also are presenting on Facebook, so you can use the comment box in Facebook Live, and also send us any comments you have on Twitter at #O'BrienCovid19. So now I'll hand it over to our first speaker, Dr. Cheryl Peters.
Great, thank you, Christine. Let me just get my screen sharing going. And do that. And hopefully you can see that now. Great, thank you. I'm just gonna, here we go. I'm just gonna stop my video just so I don't distract myself there. Okay, well, thank you so much, Christine, for the kind introduction, and thank you to the O'Brien Institute for inviting us to be here today for this webinar in the series, Anatomy of a Pandemic. So I'm gonna just give, I actually only prepared 10 minutes, so maybe I'll talk a little slower than I normally do. I'm going to give a little introduction to the grant that we are doing as a team, and then I'm going to talk a little bit about the first study that my sub-team has done, which is on coronavirus as a hoax on Instagram. So I'll tell you a little bit today about the project that Drs. Rachul and Pennycook and I are working on as part of CIHR's Rapid Response Research Funding for COVID-19 projects, where we're basically studying what the COVID-19 infodemic looks like. And I've got a definition up there of what the word infodemic means. It was also in the invite that you got. Basically, what we're trying to do is map the health-related misinformation and disinformation landscape, and I'll define those for you in a minute, as well as studying the impact of coronavirus misinformation on individuals and communities. Then I'll briefly present some very new, as of yesterday, results from my smaller team on the concept of coronavirus as a hoax and what this looks like on Instagram, namely how conspiracy theorists and others have jumped on the idea that governments or other organizations have made this all up. So first, to talk a bit about our grant, this is the title of it, so Coronavirus Outbreak, Mapping and Countering Misinformation. As Christine mentioned, we are led by our esteemed colleague, Tim Caulfield. The three of us, Drs. Rachul and Pennycook and I, are the co-investigators, and we have a very long list of collaborators that includes experts in science communication and journalism, in public policy, media studies, the arts, and cognition, and more. So a very, very large team that we've pulled together. As I mentioned, I want to provide you with some definitions that will help to frame our topic today. So the dark side of the infodemic is the inaccurate information that's being shared. Inaccurate or disordered information is classified by whether it is false, harmful, or both. So you can see here how those kind of overlap into a Venn diagram. On the left side, misinformation, this is information that is false, but it is not created with the intention of causing harm. This doesn't mean it won't cause harm, but that actually wasn't the intent by the person who created it or who shared it. In the center of the Venn diagram is disinformation. So this is information that is false and that is deliberately created to harm a person, a social group, an organization, or a country. And so what I'm going to talk about today is this area mostly, which are conspiracy theories. On the right side, we don't deal with this so much in our project, but I wanted to include it just to be complete. So that's malinformation. This information can be based in reality. It can be used to inflict harm on a person, on an organization, or a country. And the example that I usually give for this one is something like revenge porn or doxing, where a person's identity or location or phone number is released with the intent of harm. In order to understand how much of an issue this is, and I'm sure that most people listening know it is because they are sort of on Facebook or Twitter or Instagram and see the things that their friends and celebrities are sharing, but just to give you a sense of what this looks like in Canada, I'm going to spend 2 slides highlighting the results of a recent Canadian study done by Josh Greenberg and Sarah Everts at Carleton University in Ottawa. So these researchers administered a survey of Canadians where they asked a number of questions about what people believed regarding coronavirus and COVID-19, and they also asked them how good they thought they were at distinguishing misinformation. So this is kind of what I find interesting about it. So this slide shows you how many Canadians said they believed that the coronavirus was engineered in a Chinese lab and released on purpose. Unfortunately, about a quarter of Canadians believe this, 26%. And you can see how that spreads out over age groups. Interestingly, younger people seem more susceptible to this one, as well as Albertans. And interestingly, of those 26%, about half of them said that they thought that they were very good at figuring out when something that they read wasn't true. I've also included an example of a tweet where you might see this shared, and you might have seen things like this come across your social media feeds as well. Here are the results from the same study when the participants were asked if they believe that coronavirus isn't harmful, but is being spread to cover up the harm of 5G technology. The good news is less people believe this one than they believe it was manufactured in a lab. About 11% of people overall believe this one, but it's pretty interesting that 58% of those people who believe this real mind bender actually thought that they could easily distinguish untrue information. Interestingly here, you'll see again that younger Canadians and people in the prairies are a bit more susceptible to this, and older Atlantic Canadians, for both of these, are actually quite resistant to these ideas. So what are we going to try and do about this concerning trend in our project? So this is a schematic of the different components of our CIHR project. The first part is truly to get a sense of the problem and what we're up against in the traditional news media, on social media, and from Google search results. The second part, which is more of Dr. Pennycook's part, is taking the results and themes of that first part and investigating the effect of misinformation on individual people and trying to figure out how we could stop the spread of misinformation about COVID-19. The third piece relates to creating evidence-based tools and policies to help organizations stem the spread of misinformation related to coronavirus and COVID-19. And finally, at the bottom there, the outputs of the whole project include a suite of resources, recommendations, visual representations, and publications. If you want to stay up to date on what we're doing, you can always follow us on Twitter or follow Tim Caulfield on Twitter. He's sharing all of our results as they come out hot off the presses. So now to switch gears for my few minutes remaining here to talk about an analysis that my sub-team is just wrapping up on for the broader project. So before I start here, I just want to acknowledge the contributions of my team, Sajad Fazal, Emma Quinn, and Stephen Sarka to this work. So this first slide here is kind of giving you the coronavirus is a hashtag hoax, which is kind of what we're calling the project. The word cloud you'll see there is actually from our study. So it's all the kind of crazy things that we found when we searched Instagram for coronavirus hoaxes. So just to frame why we did this study in the first place. So while I do think it's really interesting to do basic keyword searches for coronavirus or COVID-19 on social media to see what comes up, we do know that social media platforms are doing better and better at removing overt misinformation when it is directly tagged to those topics. So we became interested in how searching for other hashtags that might have peripheral relevance to COVID-19 might uncover ways in which misinformation can be shared or spread in particular groups of people. So we became interested in the idea of hoaxes, or of coronavirus itself being a hoax. Many of you might have heard your great uncle or perhaps the president of the United States say or share some element of this particular misinformation variety. We also selected the most popular co-hashtag with hashtag hoax on Instagram, which was hashtag government lies on the day that our data collection started, and hashtag plandemic as the most popular co-hashtag that had some more relevance overtly to coronavirus, just for comparison. We collected 10 posts a day per hashtag for 10 days without repeats and kept English posts to answer the following research questions. So what are the dominant themes of social media posts marked with these hashtags? And secondly, are there lessons to be learned about co-branding of COVID-19 related posts with other authority questioning or conspiracy theory driven hashtags? We used content analysis in NVivo software to identify these broad themes, as well as some very specific nodes within each broad theme for the texts in the posts. We also examined whether the image was relevant to the post. So an example of an irrelevant image would be if a person posted a selfie when the text under the post has a screed about 5G, for example. Finally, we looked at how frequently posts from these hashtags were directly linked with COVID-19 or not, or if COVID-19 was implied as linked, if not overtly stated. So this slide shows you, it's a bit busy, so I'll walk you through it. It shows you the results for the 5 broad themes that we found, which are along the left-hand side there, as well as these 21 specific nodes that we coded by hashtag. So the numbers here represent the number of times a post was flagged with these nodes. So there are more than 300 posts flagged here because a post could be coded with more than one node. The green colors here are meant to be looked at as a heat map. So they're meant to draw your eye to the most frequent nodes. So you can see that the general mistrust was the most frequent broad theme, and the concept of the government lying to us was the most frequent node. The second most common theme was conspiracy theories, which is what we found, or where we found out as a team how popular flat earth conspiracy theories still are, which I did not know. Perhaps not surprisingly, we also found a large number of posts with anti-vaccination themes. However, on the bright side, one of the broad themes we found was anti-misinformation, which largely included examples of healthcare professionals decrying the fact that so much misinformation was spreading about a very real virus and disease that they are dealing with in their day-to-day lives. This slide shows how these broad themes intersected with COVID-19 directly, or whether COVID-19 was kind of implied or not at all. So here the posts again add up to more than 100% because posts often had more than one broad theme coded. So first takeaway from this slide is that the quarantine and the anti-misinformation posts were often directly about COVID-19, which makes sense and is not so much of a concern, as these are more often sharing either good or fairly neutral information about COVID-19. However, what concerns us about this slide here is that you can see that 2/3 of the posts that had some kind of general mistrust themed coded, were more than half of them were either directly or indirectly connected to COVID-19. Similarly, of the 45% of posts that we tagged as containing some kind of conspiracy theory, about half of those had some direct or indirect link to COVID-19. So they're kind of co-branding these concepts together. This slide is pretty fun. It shows some of the actual images from our study. And I will say that we checked last night and all of these are still up on Instagram, so they have not been removed. In the blue boxes, I've noted there which nodes that we coded for each one, just to give you a sense. And the posts are organized in panels based on whether they were directly linked to COVID on the left side, whether they implied a link to COVID, or whether they didn't link to COVID at all. So a few things I wanted to point out here. The weaponized bat one is kind of interesting, and this is one where we've talked about it a little bit within our team. I think this is satire, in which case it would be misinformation, but there's so many wild things that we saw that perhaps it's not satire, and I can't really tell anymore. That's definitely changed our perception on what people actually think and why they're sharing things. You can see here, perhaps you haven't seen this, perhaps you have, that Bill Gates is featured as a particular villain in a lot of these posts, mostly in these linkages to anti-vaccination. People think Bill Gates is coming to vaccinate us all and using COVID-19 to have a ruse for that. So I just have one final slide here. So I just want to give time for my colleagues as well. So we found that the most frequent theme of these hoax-related posts was general mistrust. So believing that governments or the media are lying to us on purpose. The second most frequent was these sort of outright conspiracy theories, some that are actually quite dangerous for public health, like anti-vaccination sentiments that we will hopefully actually need a mechanism soon to vaccinate billions of people. So this is very, very concerning. We found that COVID-19 is commonly being represented in association with authority questioning beliefs. And this is not trivial, I don't think. We're connecting kind of a very serious public health threat to feelings of government mistrust at a time when we really kind of need to trust the government and do what they say in order to curb the spread of the virus. And that these are spreading in particular in these skeptic communities might lead to those groups themselves either decreasing their public health practices or perhaps encouraging others to do so. Thank you so much. This is just some information for getting in touch with me on Twitter or by my email. You can also follow these Twitter hashtags. Our team is using these hashtag check then share, infodemic, and COVID-19. So you'll find a lot of our posts if you search there. And again, just thanks to the team and to CHR for funding this research.
I guess it's on to me now. All right, hi, I'm Christen Rachul from University of Manitoba. So in addition to the claims that the pandemic is a hoax, the infodemic also includes a spread of health-related misinformation, like how to treat COVID-19 or how to prevent getting the virus from becoming ill. So one topic that can be considered misinformation is the concept of boosting your immune system. And while this topic was quite popular even prior to the pandemic, as we can see in this chart, interest in immune boosting rose considerably in March, particularly in the week following the WHO declaring a pandemic. So while the idea is popular, the fact that somebody can boost their immune system is misleading, and neither an underactive nor an overactive immune system is desirable. And in fact, some of the early research has even suggested that an exaggerated immune response might be implicated in respiratory failure in patients with COVID-19. But that all to say, to date, there is no evidence that any product or practice, apart from a vaccine, will enhance anyone's immune system in order to protect them against COVID-19. But despite this lack of evidence, there is still a general belief in the public about the benefits of immune boosting. We see these benefits being touted by celebrities, by wellness gurus, supplement companies, among others. And this has resulted in a lot of popular representations that link immune boosting with the coronavirus. And this discourse provides an excellent case study for how the spread of misinformation can be quite complex and can be more subtle than some of the bold claims that we see with hoaxes and conspiracy theories about the virus. So to investigate further, my team and I conducted a Google search on April 1st, 2020, using the terms immune boosting and coronavirus. And this resulted in a data set of 227 unique URLs or web pages. And we conducted a content analysis that focused on how the web pages portrayed immune boosting and supplements and what immune boosting strategies were being suggested in the web pages. So our first, we coded the types of websites that the web pages appeared in. And we found the most common type of website in our data set were news websites like the CBC. And this was followed by commercial websites. So this included things like retail supplement companies and for-profit wellness clinics. Next, we coded web pages for how they portrayed the concept of immune boosting. And we were surprised to find that about 85% of the web pages portrayed immune boosting as a way to prevent getting the virus or becoming seriously ill with COVID-19. And less than 10% of the web pages provided any critical scientific perspectives on the concept. So while the web pages suggested quite a wide range of ways for boosting immunity, which I will get into in a second, 40% of the web pages portrayed supplements such as vitamin pills and IV drips as a beneficial way to boost one's immune system. And in addition, just over 20% of the web pages were selling or advertising an immune boosting product or service. So in terms of the suggested strategies for how to boost your immune system, we recorded 82 different strategies. And by strategy, I mean the actions that people can take to boost their immune systems against COVID-19. So rather than go through that whole list, this chart shows the top 10 strategies that we found that appeared in our data set. So vitamin C, a healthy diet, sleep, exercise, and zinc are some of the most commonly suggested strategies. And I'll note that the suggested sources of different vitamins and minerals, such as vitamin C and zinc, may have been through one's diet, from a supplement, or from both. So we dug a bit deeper into the results. First, since one of the aims of our study was to explore the messages about immune boosting that people are exposed to on the internet, and because people don't tend to look further than the first 2 pages of results when they do an internet research, we compared the whole data set to the web pages that appeared in the top 20 search results. And we found no significant difference between these 2 samples in terms of types of websites or how immune boosting and supplements were portrayed. Second, we compared the types of websites with the portrayals of immune boosting and supplements, as well as the suggested immune boosting strategies. And perhaps not surprisingly, commercial websites were significantly more likely to portray immune boosting and supplements as beneficial, and we're more likely to be selling or advertising a product or service than the other types of websites. However, the top immune boosting strategies in the commercial websites were very similar to the overall data set and the other types of websites. So sleep, a healthy diet, vitamin C, exercise, and zinc were the most commonly cited ways to boost your immune system in the commercial website. So what does this all mean? Apart from the dominance of the belief in immune boosting to prevent COVID-19, the most striking finding was that some of the most commonly suggested strategies for boosting the immune system are diet, sleep, and exercise. And these are well-known strategies for maintaining health under any circumstances, and they have a fairly robust evidence base. Yet in our data set, these strategies fall under the title of immune boosting strategies when they could have, or perhaps should have, been labeled as strategies for maintaining one's health. So this suggests that the phrase immune boosting seems to have taken on what is known as a health halo, similar to other popular terms that lack clear definition, like natural or gluten-free, that are used to garner the public's attention for a story, an idea, or a product. So using terms like immune boosting in conjunction with evidence-based advice for maintaining one's health, like eating a healthy diet, sleep, and exercise, can inadvertently legitimize the concept of immune boosting and make it a potent marketing tool. So for example, in the commercial websites in our data set, we often see immune boosting strategies that lack evidence listed alongside and on par with evidence-based strategies like diet, sleep, and exercise. So this demonstrates an implied rather than explicit form of misinformation, where context and associations with other healthy behaviors or relevant science do suggest or they infer efficacy and benefit. And this presents a couple of challenges. So these first, we'll have to grapple with these less overt, excuse me. We'll have to grapple with these less overt forms of misinformation when developing effective policy responses intended to address the spread of misinformation during the pandemic. And second, we don't know how these immune boosting messages are comparing with the messaging from public health experts. And we don't know whether they have an impact on people's health-related decisions and actions. However, we do know that the public is increasingly going online to seek out information, and that there's been a lot of conflicting messages online during the pandemic. So this presents a significant challenge for people right now who are seeking scientifically accurate information and advice right now. So I just want to thank members of the research team who helped out with this project, as well as our funders who are listed here. And I will pass it on to Gordon Pennycook.
Okay, so let me just start up my screen here. Great. So Gordon Pennycook. My role in the collaboration is a bit different. What I'm focused on is trying to figure out ways from a kind of more psychological perspective to fight, falsehood, misinformation online. And part of that is understanding why people believe falsehoods in the first place, and the extent of misperceptions. And we're going to do a project on why people are hesitant to get vaccinated. But what I'm going to talk about today is specifically about sharing false content online. So this is work in collaboration, in addition to the people that I mentioned, with Dave Rand at MIT. And some of the work that I'm going to discuss is before we got funding. In fact, all of it is technically before we got funding, but it was related to the stuff that was in the grant. So the key question that we're interested in here is, how do we stop, or at least slow, the spread of false information on social media? Okay, pretty simple question, but how do you do it? And given that my background is in psychology, the kind of natural first question that we like to ask in the space is, why is it that people share false information in the first place? There are a few different kind of ways to think about this. One possibility is that people just can't really tell the difference between what's true and false, right? They lack maybe media literacy or the background knowledge, or in the case of misinformation related to COVID-19, they don't know it's a new phenomenon. They don't know anything about it. That's one possibility. And so what I'm going to describe to you is this. Mostly this is going to be data, and so we do a simple experiment that basically illustrates a few things. First, I'll describe what the actual study is. So what we do is we find actual examples of, in this case, political fake news. This is a headline that is constructed without kind of any regard for the truth. It's just made up. Something about migrant caravanners. This was a headline from the congressional election, 2018. And what we do in this experiment is we just ask people directly, do you think this is true, basically? To your best of your knowledge, is the claim accurate? Okay? And so we can figure out based on that whether people can discern between what's true and false. We have false headlines. We also give them true headlines from mainstream sources, of course. But what we also do for a separate group of participants is we ask them, instead of about accuracy, we ask them, would you share this online? So this is kind of hypothetical. We're not running the experiment on Facebook. It's in the kind of lab context. It's an online study, of course, but they're not actually sharing the headline. But we just want to see which headlines people are kind of willing to share, or at least say that they're willing to share. And then we did this more recently using false content related to COVID-19. This is an example. Obviously, vitamin C does not protect against coronavirus. And this is what things look like. So when you ask people to rate how accurate they think the headlines are, this is what you see. People are actually quite good at distinguishing between what's true and false, right? You can see the gap here between the true and false content is quite large, right? So concordant just means the headline, because this is political content, is like pro-democratic and the person's a Democrat, or vice versa for Republicans. Discordant is if the headline was pro-democratic and the person's a Republican, right? And so people obviously believe the things that are consistent with their ideology a bit more, but the bigger difference is they believe the things that are true far more than the things that are false, right? They only believe in the false content, like that's consistent with their ideology, a little bit less than 20% of the time, right? Now, what happens though when you ask people about what they would share on social media? And this is what you see. The gap decreases substantially. In fact, there's no gap at all for politically inconsistent content, and there's a kind of a small gap here. In fact, what's really interesting is that if you look across, you see people are sharing false content that's consistent with their ideology almost 40% of the time, but these people, a different group of people, only believed it less than 20% of the time, right? And so what this implies is that people are sharing content that they could identify as being false if they bothered to think about it, right? This tells us that people can distinguish to some extent. I mean, they're still believing false content 20% of the time if it's consistent with their ideology, but they can distinguish between what's true and false. They're just not doing that when they're deciding what they want to share on social media, okay? And we find the same thing in the context of the COVID content. So here, they're sharing the false content, 40 to 45% of the time, but they're only believing it like 32-ish% of the time. So people are sharing 10% more content than they would probably believe if we asked them directly, okay? Which obviously is a major problem. All my little things are there. I'll have to remove those. Just give me 1 second. Here we go. So this idea that people can't distinguish between true and false just doesn't seem to carry water. Of course, there are going to be cases where people can't tell the truth from falsity. Like there were at least 20% of the time using the headlines that we had, and it was higher for the COVID, was like above 30%, where people thought that false things were true. And some people are going to be better at that than other people. But this does not really explain that much about why people are sharing it, because they don't seem to be thinking about it that much. Another possibility is that people are sharing this content because they just don't care about whether it's true, right? They thought about it, but they're going to share it anyways because they have, some other kind of motivations. They want to make a political point or whatever, or they think it's funny maybe, or there's lots of different reasons why someone might share something that they know to be inaccurate. But when you ask people directly, do you think it's important to only share kind of accurate content, or just to indicate, like we've done here, what they think is important when deciding what to share? Almost everybody says accuracy is extremely important, and they rate it as one of the most important things. And so people have a preference to only share accurate things, and just ask anybody. Like even the people who share, if you have the crazy aunt or uncle who shares false content, as I do, they think it's accurate probably when they're sharing it, and they definitely would say that they care about truth. Okay, there's not many people that are so cynical to not care about it. And so what we're arguing in this work is that the social media context is basically distracting some people from this regard that they have for accuracy, right? There's other things that are more salient on social media, such as social validation and reinforcement. You get likes from things that grab people's attention, or that are provocative, or they evoke moral outrage, right? You want to attract more followers, or make your friends happy, or whatever, get more likes and comments and so on. Or you can signal group membership, particularly in the political domain. I shared this, and so you can trust me as a co-partisan, basically. Okay, so these are just some there's probably more reasons why people share things for reasons that are apart from truth. And so what we're kind of trying to argue here is that the platform design of social media, the social media platforms that people usually use, seems to interfere with, what people care, the actual kind of salience of accuracy. It kind of distracts people from thinking about accuracy in the first place. And so our intervention here, the thing that we think we can implement to help remediate the issue, is to make accuracy more salient, to kind of prompt people to think about it in subtle ways, because once they think about it, they can actually do some of the work to distinguish between what's true and false. And so what we do in these experiments is, in the control, this is exactly the same as what I showed before, where in this case, we're just asking them how likely they are to share content. And you can see that we did this with both political news and also COVID-19 news. Obviously, they're willing to share more of the COVID-19 content than the political content because it's more salient at the time. And so people don't distinguish between true and false that well when they are making judgments about sharing without a prompt. And what we do in the treatment, the experiment, is the people in this condition are told, they're given one headline and asked, just do you think this is accurate? And so you can see from the blurb at the top here, this was run in 2017, which is why it says 2016, 2017. Well, we just say, for a different study, we want to know if you think this is accurate. Okay, so we just give them one headline, just do you think this is accurate? And then they move on to the task, which is identical across the two conditions, where we ask them about whether they would share the content. The sole purpose of this, we don't care what they say, we just want them to think about accuracy before they start making decisions about what they should share. Okay, and so it's just a way to prompt them to think more about what's true and what's false when they're making judgments about sharing. And lo and behold, what you see is the gap between true and false. That is the extent to which people are distinguishing between true and false content. It increases, in fact, it doubles. That one single kind of reminder doubles the extent to which people are discerning between true and false content. And you see the same thing in the COVID context here. Okay? You see the gap has increased. This small gap here gets wider. People are discerning between true and false content more if you just prompt them to think about accuracy a little bit, okay? And so just to wrap up, this is just kind of one simple way to do it. And we have another experiment that's presently under review where we do this on Twitter, which I don't have time to explain, but we sent people direct messages that ask them about accuracy. Most people ignore the messages, but that still improved the quality of the content that they shared on their Twitter profile in the 24 hours that followed the message. And so what it basically indicates is that this is one possible solution. It's not a full solution. It's one element of a solution in addition to like basic fact checking and other things that might help people make better decisions about what they should share on social media. Okay, and the kind of benefit here is that this is directed towards individuals, right? That is, you don't need fact checkers or anybody else to decide what's true. People can do it to some extent themselves, but we just need to prompt them to do so because they aren't doing it naturally on social media, it seems. And so Facebook in particular has a kind of issue with the fact-checking approach. They don't want to be arbiters of truth. And so this kind of approach gets around that a bit. It puts the effort back in the hands of the individuals on the platform. It's also scalable in the sense that part of the issue with fact-checking, which we and I think is great, in addition to what we're trying to propose here, is that the problem with fact-checking is that you have to keep up. You have to be able to fact-check the falsehood somewhat as fast as they create it, which is basically never possible. You have to, and so in this case, we can just change the way people interact with social media to some extent, and show improvements on how the decisions that they make. Of course, there's huge room for optimization, right? We've just done a few experiments. We've done other ones that I can't discuss. I don't have time to discuss, where we find we can increase or decrease the effect depending on the type of thing that we do. But if a social media company were to adopt this, they could do huge RCTs with lots of different elements to get the best kind of messaging, and not just that, but to change the type of messaging over time so that people don't, get too used to it and so on. So that's the basic idea. To that end, what we're doing right now, we're working with Jigsaw, which is the R&D arm of Google, to try to optimize the approach. And so here are the two papers that we have. The one that relates to COVID-19 in particular is in press now at Psych Science, and the other one, which has the Twitter experiment I mentioned, is also available online. So that's it for me. Thank you for listening. And so these are the other funders. In addition to the CIHR, we have some other people that have been funding this work that I thought I should mention. Thanks.
Thanks very much to our three speakers, and now we'll open it up for questions. So we already have a few questions that people have submitted, and I just want to remind our listeners that you can send your questions in through the Q&A box on Zoom. So the first question is from an anonymous attendee. The question is, one variation of misinformation I've been seeing on social media is where someone makes a wild claim, someone else asks for, quote, evidence or, quote, proof, and a misinformation webpage or non-peer-reviewed paper is provided in response. This tells me some people do understand that, quote, proof is needed, but don't have the understanding of what constitutes this proof. Does your work have any insight into this situation? So I don't know who wants to answer that. You can maybe all answer it, provide your perspectives.
So by the way, I can't get my video back on because it was shut off. So just FYI, that's why I'm blank. I'm
okay,
still wearing pants. Yeah.
We'll see if we can get the video on for you as well.
Okay, there we go. I'm back. Yes. I think it's an interesting question. I could start with a little bit. So one issue with the social media thing related to what I was talking about, which is that people really probably do care about whether things are true or false. But when you tell someone that something is false, there are also other things that they care about, which is like saving face, and sometimes you get reactance, and so it's a delicate thing that has to be done. The way that you approach people and fact check them, especially if it's someone you have to do it in a non-accusatory way. And I think what we often do is we kind of we assume that someone is doing something nefarious or that they don't care about whether it's true, and then we approach them in a kind of antagonistic sort of way, which I don't think helps at all. So that's all I would say, to keep that in mind basically when you're approaching people.
Christen and Cheryl, did you want to add any responses to that question?
One thing that did come to mind, in addition to what Gord said, is just the idea of science literacy. So sometimes people, I think, really they don't have the ability to sort of say this is a real proof of something, and that is kind of because in some ways due to limited scientific literacy. I totally agree with Gord, though, that if you are going to try to sort of counter that with people that you are friends with or in your family, that it's great to come at it from a place of humility and helpfulness and not sort of accusatory.
And Christen, did you want to add anything?
I'm not sure I have anything to add to that. I think those two things popped into my head, the scientific literacy and just how we actually relate to people.
All right, we'll go on to the next question. It says, in your expert view, was Trump's infamous press conference suggesting that ingestion or injection of Lysol recognized to be, what do you think it was recognized to be, an intentional satire? This person has read that there was a bump in calls to poison centers in the US following this statement, hopefully fact-checking rather than seeking antidotes. Who would like to take that one on?
Not me. I would say that the only thing I'll say to that is like, this is part of the issue with satire is that it has to be acknowledged, or like if you want to say something satire, it should be readily
obvious, right?
Yeah, it should be obvious. It should be. It's not satire. People don't realize it's satire.
Yeah, I'll add to that. I think there needs to be shared understandings for satire to work well. And I think when you're particularly in a position of power like Trump, you need to be very careful with your suggestions and recommendations. Even if you are joking, there's going to be a large portion of your listeners who won't catch on to that. And so we have seen the fallout of that with some of people trying that out.
Okay. So there was a question about the funding for this project. I just want to remind it that this is a CIHR funded project, but do any of you want to add anything else about your funding?
I could just say that I've got funding we've been doing work on political misinformation for a long time, and so that was part of the reason why we did the rapid response grant, was to basically extend that to this context, and so that's why I talked about both those things in my talk, and so that's why there was a bunch of different funders on my list.
Excellent. Okay. So the next question is, what do you all, or how do you determine what is true and false?
Right. Well, I mean, basically what we're trying to do is use peer-reviewed scientific literature to determine what is true and false. It is, I will say, it can be challenging at times, especially in sort of a fast-moving epidemic and infodemic. Sometimes things do change, and science does have a lot of gray area that isn't that well conveyed to the general public. So, for me, seeing something, be a recommendation one day and then change a week later, it doesn't really get my hackles up, but I totally understand that can sort of, it can be difficult actually to discern, and it does erode public trust in that way. But basically, we're trying to use peer-reviewed scientific literature to determine what's true and false.
I suppose the overlay on that, which also makes it difficult in science, as we know that things will evolve over time. So sometimes, in my field of diet and cancer, we used to recommend that people eat a lot of, let's say, fruits and vegetables for colon cancer, but then they might over time realize that fiber wasn't so important to reduce the risk. And so over time, things may change. And so people will start, not believing, shall we say, some of the news that comes out. Okay, so the next question from Jamie Day is, what do the speakers think about Twitter's efforts to remove false tweets?
Yeah, I think it's great. I mean, to the extent that, so coming back to the last question, they only removed egregiously false things. And so like there's a lot of ambiguity in between what's true and false. And to that end, I would highly recommend an essay called Relativity of Wrong by Isaac Asimov. You can find it online. It's a great way of thinking about science. So that's fine. Like they're removing egregiously false things. And the thing that they're doing now, which I thought was excellent, is if you want to retweet an article, they prompt you if you haven't opened it, on Android phones at least. So it now, if you go to retweet something before even looking at the article, it asks you if you want to look at the article, which I think it's a great approach. At least they're doing something, and so that in my opinion, that's great.
I suppose the question is, could they be doing more? Is there something else that they could be doing as well?
Yeah, I think I was saying too in our Instagram study that Instagram is not doing that great of a job. I forgot to mention as well, because one of the hashtags we look at was plandemic. And I forgot to mention that we actually did that search before that plandemic movie kind of came out and was repeatedly removed by YouTube over and over again. Sort of in real time, it kind of spread across my Facebook. I don't know if everybody saw that. But yeah, I think they could be doing more. And I think different platforms have taken different approaches. And I think probably it's going to evolve, and their tools for figuring out what is harmful and what is false will evolve and improve over time.
Okay.
Yeah, one other thing on Twitter, what they could do more is listen to us and implement with the thing that we want to do, or at least at the very least, because when we're trying to do experiments on this ourselves, like on Twitter using ads and stuff like that, or other approaches, we actually have to fight with Twitter to get we have to use bots in some cases. They're always labeled as bots, but Twitter removes them on us. And so if they had a better partnership with researchers, they might have better outcomes.
Well, that's actually an extremely important point, isn't it? That you have to actually engage with those social media platforms from a research perspective. Okay, so the next question is, what do you think the impact of fraudulent studies in Lancet and the New England Journal of Medicine that were now retracted will be on the misinformation on social media regarding COVID?
I mean, it's hard to predict the impact, though, and I apologize, I can't remember exactly. I remember seeing the headlines, but I can't remember exactly what the particular studies were on. I think one was on masks, perhaps, if I'm remembering correctly. But I mean, we know that for some studies, they carry on a life for many, many years after they've been retracted, and there is a potential that these studies will continue a life and be spreading around. I'm not sure if I can say more about in terms of the impact. It's a little early to tell what kind of impact that will be. I think it's just important to be aware of that and to continue for scientists, for health professionals, for people who are aware that these studies have been retracted, that message is continually getting out, especially if we are seeing people passing on this information. And as both Gordon and Cheryl said, doing that also with some humility.
The only thing I would add to that is that, Cheryl said earlier about science literacy, the fact that they were retracted is a positive sign, right? This should be taken as, you should increase your trust in science given that these studies were retracted. The fact that they existed and they were published is a problem, but that science doesn't mean that everything is always true. It just means that we're trying to work towards being less wrong, and retraction is a move towards that.
I suppose what we also have to recognize during this time period is that we have extremely rapid publication from any COVID research. And so the normal peer review processes have been shortened, and sometimes things are slipping through. And so that requires extra vigilance right now. Okay, so the next question is, it was commented that vitamin C was deemed as not helpful for building the immune system when many doctors, including those in Wuhan, had treated COVID patients successfully with IV vitamin C. Why would you dismiss this as been?
I think just there's not really a lot of evidence. So even though it's a popular idea and it's been around for years and years and many people still live by that, we do not actually have evidence to suggest that vitamin C boosts immune systems or builds immune systems and helps fight immune system. As we were saying, we're still learning, but to date, we don't have any evidence, but that doesn't mean that just because doctors are using it doesn't mean that there's evidence for it. So when I said that my claim of the vitamin C not being helpful is just that I don't see any evidence for that in the peer-reviewed literature that vitamin C is.
Does anybody want to add to that comment? No? Good. All right. So Tanis Fenton is wondering if you could provide some wording that shows a helpfulness and humility. She says she has considerable knowledge and others might not, and she says it's sometimes hard to be humble.
It's a good question. Like I think it kind of depends on who you're talking to, I guess. But so I'll give an example of what I had done when I fact checked my auntie. If she was spreading something, it was a doctor that had been discredited for like giving bunk cancer cures to kids. And so I said, I'm not sure that this is really a trustworthy source, Auntie. Like it sounds interesting, but I'm not sure that this is a good source, and maybe should look into it a bit more. But I didn't say, in this case, I didn't say, because I wasn't going to fact check the entire video nor even watch it because it was like 20 minutes long or something. And so I just said that doesn't seem like a great source. You should maybe look into it. And then she said, great, thanks. And then we moved on.
So a very direct approach sometimes is the best. Does anybody else want to add to that comment? Any other tips that you have?
I guess the only thing I'd add is like, you could just say things like, I might be wrong, but, and then say what you're going to say anyways, that it's hard to do if you know that you're not wrong, but, yeah.
Okay. So the next question is for you too, Gordon. Have you been tracking the sharing of misinformation over time prior to Trump's candidacy and then election? This individual is curious about the impact of his vocal and public claims about false news and the shortcomings of the media that has shaped people's propensity to share information with less consideration for accuracy. Clearly, conspiracy theorists, anti-vaxxers, etc., predate Trump, but this questioner is wondering, but they don't remember the idea of fake news being in the public consciousness before he started using that very frequently.
Yeah, that's a great question. No, I'm not. I mean, it's a huge pursuit to try to track all of that information. It's also completely outside of I don't know how to do that. What I do is I take examples, and we've done like hundreds of them, trying to I go on Snopes and I find false headlines and things of that nature, and then run studies on it, which is to some extent quite a bit easier than what is being proposed. But tracking the entirety of false information on the internet is not an easy task. I will say that like fake news is a moniker. It's just it rose as a specific reference to one specific form of misinformation, but the problem is much larger than that, and has been around for many, probably as long as there's been information, there's been misinformation. So, but there might be that there's increases as a function of what Trump is saying, but I don't know how to analyze that.
Okay, so we'll go on to the next question. Has hope been an aspect of your research? Do people really believe their actions will work, or are they performing, or that they are performing hope? Are people acting on strategies simply in order to do something, in order to feel that they have a situation under control, using hopefully harmless actions beyond what medical messaging can provide? Who wants to?
So I can tackle that. So I haven't been looking at hope specifically for this project yet, and maybe that will come up as we continue our research. I have looked at hope in previous research on other unproven therapies and how the role of hope really guides people's decisions to try new things, just to do something, as you say. And it can be very powerful, and I think that's where it's important to look at from a regulatory perspective of when when their hope is being preyed on by marketing strategies by companies, particularly for unregulated products that, if we're talking about vitamins, where if you do, there is a possible, you can overdose on a vitamin and that can be also harmful. And so, well, some of those actions and strategies that I found, at least in do seem quite harmful. And as I said, there's even some strategies that are actually quite legitimate strategies for maintaining your health. It is important for kind of from a policy and a regulatory response to also look at when people's hope makes them vulnerable, and how can we be protecting that. And making sure that people are getting the information they require so that the actions they're taking won't be harmful.
Oh, that's very good. We see this all the time in our field of cancer. Anyway, we'll go on to Gary Jakes. He talks about websites like Oxford's Our World in Data or Hans Rosling's Gapminder provide universal access to underlying verified data and provide interactive data visualizers. Do you see this type of service being used to improve media's presentation of stories and allow users to verify the message? Who would like to take that one on? Cheryl?
I can start, sure. So I'm not familiar with this site, actually. I'm going to check it out. But I do think that there's a place for sort of fact-checking or data visualization to be shared with media. I think a lot of science reporters are very good. I think papers should hire more of them. And a lot of them do have quite a good relationship with researchers. And I think that when they do have that, they kind of have access to these. So getting it into the hands of other people that perhaps, science or health isn't their main beat might be useful, because I think the ones that are in health and science are doing quite a good job and probably are using things like that. So I think it would be sort of figuring out how to get it into the hands of other people that are doing reporting, maybe a little bit outside of their normal beat, that would help to improve this. But absolutely, I think having more tools, especially visual tools, available to people is great.
Excellent. Does anybody else want to add anything to that answer?
I'll just say that anything that gets more of the actual data in front of people is a great thing, because a lot of the reporting is that you have to kind of take the scientist or the reporter at their word, and if you can see the actual data, then you can interpret yourself, which is always, there's gonna be some difficulties with that, but it's a positive sign in my view.
I've actually been very impressed with the quality of some of the mainstream media in presenting actual data on COVID. It's been really quite sophisticated and a good source of information. So this is a question for Dr. Rachul from a watcher in the United States. So thank you very much, Sean Westmount, for sending in your question. One of the fundamental misconceptions that seems to be held by President Trump is that physical strength of perhaps emotional or moral strength are somehow related to immunity from disease, as evidenced by his comments about people he knows who have gotten COVID-19, when he has expressed surprise and puzzlement because, quote, he or she is such a strong person. Did you find similar misconceptions in the articles you've read so far, that somehow immunity is related to physical, emotional, or moral fitness?
So I'll say for the moral fitness, no, I don't remember seeing any of that in our web pages. But in terms of sometimes, especially when one of the top strategies, as I mentioned, was exercise, and sometimes that gets portrayed as making your body strong, and that builds your immune system or enhances your immune system. Another really common strategy, which was on my chart but I didn't mention it specifically, was reducing stress and self-care activities were also quite high on the list of suggested strategies to boost your immune system. And the idea that people who are perhaps, I guess to use the word, I don't know, I want to say strong person, but that somehow self-care will build your immune system and keep you healthy from COVID-19. So and perhaps it will, there are all benefits of the prevention from contracting a virus. But that was definitely, I would say, the physical and emotional misconceptions were there. But I did not see anything about moral fitness in our data set.
And I think this will probably be our last question. This is for Cheryl. Cheryl mentioned that we need a mechanism to vaccinate billions. How do you see this as being effective with a virus that reportedly mutates readily?
Great, thanks for that question. So I will say I'm not a virologist, but we have lots of vaccines that we have for things that mutate. So the flu is a great example. So we get yearly flu vaccines, and every year they're a little bit different based on the flu mutating. So I think still there's a very large role for vaccines to play in coronavirus. And the thing about the flu vaccine as well is that even if it doesn't exactly work to prevent the flu, it can often reduce the severity of symptoms. So if we could have a vaccine like that for coronavirus, even if it maybe doesn't prevent it totally, if it reduces the severity of symptoms, it would still be a massive benefit. And to get up to sort of a level of herd immunity, we will have to vaccinate a lot of people.
Okay, thank you very much. We didn't quite get through all of the questions, so I just wanted to let our viewers know that we will be sending these questions to our speakers, and we'll attempt to get responses to you if we haven't been able to answer your question. I just want to take this opportunity to thank our three speakers today for very interesting and enlightening presentations. And we also want to wish you all the best for the rest of your research, which I think is going to add a lot of valuable information for us on COVID-19. And I also want to thank our viewers for joining us today.